on Animal ER. A hysterical owner
I'm really concerned. It's kind of like my baby.
proves more challenging for her doctor
Try to stay calm if you can, okay?
Yeah.
than the patient.
Okay, you can just sit down.
Sorry.
It's okay. That's the bone sticking through.
Fixing a horrible leg injury,
You've got the perfect storm there for nasty infections. This is bad.
which is one of Gulf Coast veterinarians
Come on, Wayne.
to the edge.
Gosh, man, this is brutal.
And a Maltese suddenly loses the ability to walk, and his surgery
Can you get Dr. Joe Manella?
becomes an all-hands-on-deck emergency.
Really doesn't want to come out.
I don't know what else to do.
It's animal medicine
You're a big fluffball.
at a whole new level. Raisin, a pointer mix, has arrived at Gulf Coast Emergency Room with a broken leg caused by a dog bite that happened a week ago.
Raisin's owner and the referring veterinarian were having a conversation about whether it would be best to amputate the leg or go for euthanasia. So he came to us for a second opinion, but there was a delay in treatment. The fact that it took so long for Raisin to get to Gulf Coast can cause some serious complications.
Surgical staff veterinarian Dr. Leah Merkins sees problems right away.
So that's the bone sticking through. Open fracture. It's a week old.
It's always very disconcerting to see bone sticking through skin. The fact that it had been going on a week was pretty evident by looking at the soft tissues around his forearm.
I mean, a small amount of swelling would be normal. This amount of swelling is not normal. Flush it, and we need to get a culture, and we need to start IV antibiotics. This guy's a pretty brave dog. I've been dealing with this for so long.
This case is not going to be a one-and-done case, and it's going to be really difficult to get a plan together for him. This leg is on the verge of being amputated.
All right, just in case, hold that foot.
After flushing the wound for 3 days, Dr. Merkins calls in orthopedic surgeon Dr. Wayne Whitney, one of the most experienced specialists at Gulf Coast.
You can kind of reimagine the bite. I would say probably one canine tooth went here, one canine tooth went here, one there. Bite wounds are a big deal. Not only are these teeth causing tremendous damage, but they're also like inoculating, like an injection, bad bacteria in the mouth. And so you've got the perfect storm there for nasty infections. The problem with Raisin was it had been growing for, you know, all these days. So it's just a nasty mess. The bone does not look very healthy. We've got to get this infection under control. This is gonna be hard. Even without seeing any x-rays, this is a bad, high-risk situation. Do you see this, Caleb? It's distal and nasty. Yeah, really chronic. And 10 days old. Yeah, that's pretty swollen still. I was hoping you would tell me how to fix it.
You're a good dog. I'm sorry this happens to you.
The infection is so bad, Dr. Whitney can't even consider surgery.
We can't just go in and put a plate and screws right now and sew it up, you know? It's infected and it'll just pus out in just a few days. We've got such a small little piece right in front of the joint. If we prematurely close this down or can't control the infection or get a resistant organism, that's gonna cause our screws to loosen and we're gonna lose that little piece of bone and then we're gonna lose the leg. This is bad, you know? It's a hard case.
Constantino is a year-old Siamese cat whose leg troubles are deeply upsetting his owner, Amanda.
I came to Gulf Coast because my cat has been limping really bad. It's to the point where he can't walk or stand. I'm really concerned. It's kind of like my baby, and I care lots about him.
Hi, good morning. How are you?
I'm okay.
I'm Brittany Neal.
Nice to meet you, I'm Amanda.
Oh, you're having a hard day, huh?
Yeah, I'm just super attached to him and
Yeah.
really worried.
Don't worry, we'll get him figured out, okay?
The other day, he fell in the litter box, and then sometimes he'll just pull himself along the floor instead of trying even to walk. And I mean, I have no idea what happened.
Okay.
So,
all right.
you
And
wanna
he's a
follow?
young guy, right?
Yeah.
He's only about a year old?
Yeah, he had a really bad experience on Saturday. So.
Oh no, he got stressed out?
Yeah.
Okay. Well, we'll try to be as gentle as possible.
But I want to tell you, I mean, these guys do feed off of your emotion.
I know.
Because, I mean, all he does really is watch you all day, every day. So if you're upset, then he's going to be upset.
Yeah.
So try to stay calm if you can, okay?
Yeah.
I can tell that she's really upset, but I need her to stay as calm as possible for Constantino's sake.
Oh, that's scary.
Oh, sorry. Okay, you can just sit down.
Sorry.
It's okay.
I just feel bad.
I know, I understand, but the more you get worked up, I promise you, then he's gonna be worked up. I can feel crepitus in his joint, which is instability.
Okay.
He has crepitus, which is a popping feeling in his hip. So knowing that he's a 1-year-old cat and he has hip pain, what my top differential would be is a fracture in the top part of his femur. But the first step is x-rays. So we do need x-rays to get a definitive diagnosis for you, and we are gonna need to sedate him.
Do you think that x-rays will do anything? Because my biggest fear is that I've had cats pass away before being sedated, so it's super sensitive.
It seemed like she was skeptical about the need to sedate a pet. She had had a previous cat that had had some sort of reaction to sedation or anesthesia. I think her imagination was sort of running wild, and she was worried about the worst possible things that could happen. I would just need you to trust me on this one and just know that sedation is the better option rather than having him so stressed. Amanda was very emotional during the consult. We don't learn about bedside manner necessarily in vet school, but I believe bedside manner is imperative. I think it's important to listen to their concerns and to be responsive. We're very invested in our patients, and it's important for clients to feel comfortable with their care that they're receiving here.
I mean, so we have to get these x-rays. You can't just tell from, I don't know.
In order to find a diagnosis for you and help him feel better, we have to do an x-ray. Sedation is essential. Constantino won't be able to tolerate x-rays and being on an x-ray table and being manipulated in a certain way, laying still on his back long enough for us to get those images.
I've literally lost it all by it, so it's just it's really hard.
You know, it's one of those things where if you want us to figure out what's going on, you need to trust us and allow us to do what we need to do.
Oh my goodness, you're a big fluff ball.
An Angora rabbit named Gandalf has an infection that's causing his eye to dangerously bulge out of its socket.
Is he able to blink at all? He blinks a little bit, but you can see when I touch his eye on this side, he closes it all the way, right? With his eye being bulging, it probably has difficulty to see.
Wow, yeah.
He can't close it all the way. You would see it, that this eye is probably out twice as much as this one.
Yeah.
When I press on top of his head, you can tell that's very asymmetric, that there's definitely a swelling associated with that whole right side of his face. Do you see this is his eye? You see all this abnormal tissue here? Normally it looks like this.
It's bigger than his eye itself.
And that's why it's pushing it out of its socket. What the CT scan is telling me is that not only is this abscess affecting Gandalf's eye, it's also dangerously close to his brain. The only thing that's separating this abscess from the brain cavity is a thin membrane at this point. If it goes past that and goes into its brain, obviously an infection in the brain is much, much more serious. A lot of abscesses are related to a tooth problem, so I wanted to see if we could actually remove that tooth. It also helps abscesses drain. Obviously, save the rabbit's the most important, and secondly, save the eye.
He's an awesome bunny. You can't tell right now because he's kind of out of it, but he's a very unique bunny. He's super friendly, really chill, loves people, will run right up to a dog, and he's a tough little, fun little guy.
Is he warm enough?
He's 98.6.
Gandalf is sedated as Dr. Chen delicately tries to remove the rear tooth.
You can see it's loose. I can't get the right angle, which is really frustrating. Basically, the problem is I have all the other teeth in the way. It's not working.
But the procedure suddenly hits another snag.
Ooh, that's a lot of blood now. I need a Q-tips. I need Q-tips and epinephrine, please.
Gandalf, the Angora rabbit, is undergoing a tooth extraction to drain an enormous abscess behind his eye.
Ooh, that's a lot of blood now. I need a Q-tips. I need Q-tips and epinephrine, please.
But Dr. Chen nicks an artery right next to the tooth.
I have it.
Unfortunately, rabbits have this design flaw where they have a pretty big vessel on the back of their mouth, and anytime the mucosa is compromised, they'll start bleeding from that area. I don't think it's bleeding still, but I'm just worried.
Oh, and he's awake now.
He's awake.
Gandalf's awake, but the tooth isn't going anywhere.
That tooth just wouldn't come out.
And that means the abscess can't drain.
If this abscess isn't drained and treated, I don't think we can save Gandalf's eye, and I think this infection may spread to his brain. We need more than antibiotics to treat this abscess.
Dr. Chen decides on a cutting-edge treatment available at Gulf Coast.
A hyperbaric oxygen chamber will put extra oxygen into Gandalf's bloodstream and the infected tissues. This will have a healing effect on the infection. We will need 6 treatments over the next 3 days.
We brought the girlfriend.
To reduce the stress of his hospital stay,
Do you want to go see your girlfriend?
his mate from home, Ariel, another Angora rabbit, will provide moral support.
Ariel and Gandalf are a bonded pair, and so the presence of a friend can be calming.
Are you setting him up in there?
Yeah, because now there's gonna be 2 of them.
His girlfriend's staying.
His lover is staying, so I'm gonna give them a more private and luxurious suite. So what are you gonna do with that?
Save it for paper mystery.
Okay, here's your lover. Your upgraded suite.
Rabbits are very social animals, and the reputation for prolific breeding is well earned. A single female rabbit, or doe, can produce a litter of up to 14 babies every month.
I like Gandalf's case. Him and his girlfriend are super cute. They're like the cutest couple. When I was a little kid, I've always had rabbits, and I don't know, I just think they're really cute and they're sweet, and they make great pets.
Oh, I have like a nose full of Angora fur.
Constantino, the Siamese cat's owner, Amanda, is concerned about putting him under sedation for an x-ray, but it's the only way Dr. Neal can confirm if his hip is fractured.
You need to trust us and allow us to do what we need to do.
Okay, yeah, I guess let's sedate him.
It'll be safer for him. But we'll take good care of him. You know, just rest assured, we're doing this all day, every day. So we'll be very, very careful. He needs some sedation to even tolerate x-rays. He's just very nervous. How did he do? Oh, yeah, look at that. Oh my goodness.
Dr. Neal's diagnosis of a fractured hip is confirmed.
There's actually a very bad fracture at the top of his femur where the ball part of this ball and socket joint has completely slipped off of the femur. So what he needs is to have this ball part removed. All right, so let's go talk to Mom because she is anxiously waiting. Okay, he's doing great. He's awake. Yes, he's alive.
So he's like the most active cat I've ever seen in my whole entire life.
Yeah,
so,
so his prognosis is excellent. He'll be able to run, jump, and play. You just have to trust us. We're doing this all day, every day, so we'll take good care of him.
So you've done like this on plenty of cats
Tons
before?
of them. Tons of them. It's a very, very common surgery.
Okay. That made me feel a lot better. I think I'm really excited to have him be fixed, but I'm just nervous about the procedure.
Today we're gonna be cleaning out Constantino's hip joint because the ball part has fallen off of the top of his femur. So we have to get this ball part completely out so it's not creating pain with the bone-on-bone motion. And my major concern really is that the owner's sitting at home worrying. I think Constantino will do just fine, but the owner, I'm sure, is out of her mind, scared and worried today. Look, and do you see this femoral head sitting there? What I do is take the femoral neck off and then clean it up. You can do the honors if you want and get it out of there. This is the femoral neck, which connects the body of the femur to the ball part of the hip joint. And then now I'm removing the other part of the fracture, which is the head of the femur. Here's our culprit. So this is the ball part of that joint. The fix is really his body healing the joint up, and he'll create a synthetic joint with scar tissue. The femoral neck connects the femoral head, or the ball part of the hip joint, to the thigh bone, or the femur. In Constantino's case, the femoral head has broken off, so we have to remove it. This is different than a hip replacement. In this case, the hip will heal on its own.
Hello.
Hi there, it's Dr. Neal calling about Constantino.
Hi, thank you so much for calling.
He's all done,
Yeah.
He's waking up now. He's doing fine, and from here, we're just gonna keep him comfortable. Owners want to pick up certainly your verbal cues, but also your nonverbal cues on how things are going. So it's really important to stay calm and positive. In Constantino's case, I expect him to do wonderfully. So I want the owner to start believing that as well.
Thank you so much.
You're welcome, bye-bye.
Bye.
Raisin, the pointer mix, came in 3 days ago after a dog bite left him with a badly broken and infected leg that had gone untreated for a week.
We need to get the thing as clean as we can to try to fix it. The question is, how are we going to do that and how long is it going to take? Is in a very happy deep sleep. We'll put a sterile catheter tip on the end of a long line to be able to flush deep into the wound and get everything out of there. So now we're starting to see clean bone, which before was covered in purulent debris.
There's no guarantee that the infection will clear up enough to allow for leg surgery at all. So Dr. Whitney meets with Raisin's owner to prepare him for the unknown outcome.
Wayne Whitney.
Hi, how you doing, sir?
Pleasure to meet you. This is a long, hard road, and you have to make sure that you're confident that the owner is committed. I need to meet with them. I'm not a carrot dangler. I'm a straight shooter, tell it how it is, and this is a very difficult and challenging case, and I think we both understand that. We could lose out if we get a bad resistant infection. Obviously, it's more cost-effective just to do an amputation up front.
No, we'd want him to be able to run again if he possibly can. Raisin loves to run. And it's just horrible when I saw that bone that had been broken whenever the fight had occurred with my dogs. I thought if I brought him to the vet, they'd just want to put him down. And a good friend of mine said I needed to get him down here. Him not being able to run would be a real shame.
Trust me, I'm giving it my best shot. I know Mr. Purnell did not want to amputate. My default is what I'd do if it was my dog, and I have to admit I tried to save it, but this is a hard case to save a leg on. Do you want to go ahead and come back and visit Raisin?
Yes.
Okay, good.
Gotta see how he's doing.
Okay.
Look at that little boy. What you doing, buddy?
Ah, there's a tail wag.
How are you doing?
Okay.
Do you remember me? Look, Raisin. Look at this. Yummy, yummy, yum.
I could see the genuine compassion that Mr. Purnell had for Raisin, and I feel very comfortable that we're on the same page. We know this isn't a slam dunk. We could do all this and still lose the leg.
You be a good boy. See you later on. I'd like to keep him whole if he possibly can, to be able to run in the grass and run in the park and just, have a full life after this.
Toby, a 10-year-old Maltese, fell down the stairs at his home and now can't use his back legs.
All right, you ready? All right, Tobes. Oh. Last night I came back from dinner and I noticed he was at the bottom of the stairs and his hind legs where, they didn't really bend, and I just felt something was wrong.
Oh, he's so cute.
Thank you.
Oh my gosh.
Toby is a great dog, and he's part of the family. Basically, he's just been with me all through college and into my adult life, I guess. So he's my little baby. I don't know, you just grow so close to them, so he just means so much to me.
Neurologist Dr. Laura Vasquez gives Toby a quick examination, but it's already clear something's not right.
Toby looks like he's paralyzed in his back legs, although he can move them just a titch.
All right, you're okay.
He's got a posture called Shift Sherrington, so his front legs are very stiff, and he wants to have his head pulled up. They'll have this posture when they have a really severe back injury. I don't think we can rule out neck still. I think we may have to talk to them about imaging his whole spine. He's not paralyzed, he's just really, really stiff. And it made me think, okay, did he fall and break a bone, or did he herniate a disc? So I want to do an MRI of his back. Sometimes when you have a really bad back injury, it can cause this change to the front legs and the way they carry their neck, and it could still be the back.
I noticed too that when he was panning, he was lifting his head up a lot more, but he didn't look the same.
Okay. Okay. As a neurologist, we sometimes see really desperate, severe cases, and we can't fix them all. And so it can be really challenging for some owners to think about worst-case scenarios in their own pets. And so they can't imagine that their dog was fine yesterday and then today is at death's door.
Is this common in, like, small dogs?
We do see a fair number of Maltese here that have back problems.
It's kind of embarrassing because you keep crying, but, I mean, it's just hard because you treat them like as if you're, you're their mom. You just want to tell them that everything is going to be okay and we're doing all we can to help you.
You're here, we're going to try to figure out what's going on. So our recommendation is going to probably be to do an MRI of his back. We just first have to figure out what's going on.
Okay.
When we look between the second and third lumbar vertebrae, he's got this really bad one here where you can actually see almost like, it looks like a rock sitting underneath the spinal cord, and the spinal cord's kind of draped over it. In looking at Toby's back on the MRI, we did see one really bad disc herniation between the second and the third lumbar vertebrae. It was pretty severe, and it was causing some spinal cord swelling.
Toby's advanced age and smaller size makes surgery risky, and non-surgical options don't offer guarantees.
Hi, it's Dr. Vasquez. He does have a herniated disc. When you have a herniated disc, if the pet still has feeling in his legs or her legs, then medical management, activity restriction, anti-inflammatories has about a 50 to 70% chance of working.
With some pain meds and just see how he reacts to it.
Yeah, I mean, that would be an option for tonight. Given what I saw in the MRI, I'm not sure that medical management is going to work for Toby. But we're going to give that a try first and see what happens.
"24 hours after surgery to fix his broken hip, Constantino is ready to go home.
Okay, here he is. Teeny Peeny. Hi, Bubba. How's your mommy?
I ended up getting like a large dog crate for him.
Oh,
so
awesome.
yeah, so
Good.
and then we also removed all of the furniture out of our room.
Very good. She calmed down and really kind of pulled her emotions together and made Constantino the priority. I was really proud of her. Teeny, are you ready to go home? I think he's excited to see you.
Thank you so much. I appreciate it.
Keep us posted, and I'll see you in 2 weeks.
Okay. I definitely am looking forward to taking him home. I'm excited to have him back, and I'm relieved that he's going to get better. So I'm obviously in a much better state of position.
Gandalf, the Angora rabbit, has had 6 hyperbaric oxygen therapy sessions, along with antibiotics to treat his infected eye.
I think it's gone down. Like, his eye seems less bulged, for sure.
Gandalf's owners are really hoping to see results with these treatments so that they can get him back home soon.
Yeah, he's opening and then closing it.
Yeah, which is good. Because the swelling's going down, hopefully that means the abscess is responding to our antibiotics. It's still going to be a long road, though, because most abscesses take months to go away, and it's just going to be up to the owners to continue with those antibiotics and make sure that his progress is continuing in the right path. Everybody who's looked at him so far all think it looks like a difference. So
it's almost even with the top of the skull again. He's like 200% better than when we brought him in. He couldn't even blink his eye, and now he's blinking and running around and acting pretty normal. So we're hoping that this will be the end of it. You're good to go home finally.
Bye, guys.
Thanks again.
Bye.
Toby, The 10-year-old Maltese, who has a herniated disc in his back, spent the night under medication in the hope that his paralyzed back legs would improve without surgery.
I recommended that we keep Toby overnight for observation. The following day, we didn't see him moving his legs at all. We weren't seeing him wag his tail like he did when he first came in. He looked weaker.
What are you doing, huh?
You know, he still had a chance with medical management, but in my gut, I thought his only real chance at recovery was with surgery.
With his condition worsening,
Just relax, baby.
Toby is quickly prepped for surgery to remove the disc material pushing against his spine.
I'm going to do what's called a hemilaminectomy.
Okay, all right. Cutting.
It's making a window into the side of the bone, and once we make that window, it's going to give us some breathing room so that we can get the herniated disc material from pushing on the spinal cord.
This is the space over the disc. This is the beginning of where we're going to do our window into the bone. And we try to remove part of the bone using these rongeurs, and then we'll drill the rest of the bone down. Make a little window right here.
Dr. Vasquez drills down through the spinal column.
I'm just very gradually peeling the bone off. Let's see what we got. I can feel the disc. He's just stuck. I can feel the disc, but it's really stuck, like it doesn't want to come out. So I'm just trying to gently probe to get the disc out. But it's stuck to the spinal cord, so I gotta be real careful. It's just really hard, like it doesn't want to come out. I have to be careful how much I touch his spinal cord, because we're in now territory where our surgery could make him worse.
You don't want to over-manipulate it for fear of causing permanent paralysis.
I can feel the disc.
Dr. Laura Vasquez is operating on Toby the Maltese to remove a herniated disc and hits an unexpected roadblock.
I can feel the disc, but it's really stuck, like it doesn't want to come out. I have to be careful how much I touch his spinal cord.
Which is putting the 10-year-old at risk of paralysis.
And the more I try to tug on it, the more worried I am that I'm going to hurt the spinal cord.
Working around the spinal cord and the nerve roots and the brain, these are very delicate tissues that don't have as much healing properties as, say, your skin or your bones.
Can you see if Dr. Giovanella is at a point where she could pop her head in for me to talk to about this case?
I am really thankful and grateful to work with a great group of other specialists.
Hey, so it's like I can't even try to peel it off the spinal cord.
I've worked with Dr. Giovanella for the past 6 years, and we just bounce cases off each other, and sometimes we say, hey, can you scrub in and look at the surgery with me? And so I am of the opinion that 4 neurologists' eyes are better than 2 sometimes.
It's there. It's just sticking.
Together, they try to carefully remove the disc material without disrupting the spinal cord.
There's our nerve root. Yep. Oh, yeah, there you go. Oh, there it is.
You were hiding in there, man.
Dr. Giovanella doesn't mess around. She gets spanking.
It was a great feeling when I finally felt that give, where it finally separated from the spinal cord, and then it started to slowly, piece by piece, come out from the canal.
There's a piece of it. Thank you.
No problem.
Team effort.
Teamwork.
Say, go Team Neuro.
It's such a relief to say, okay, we did what we set out to do, and we're gonna give him the best chance, and now we just gotta see how he does post-operatively.
Raisin, the pointer mix, is suffering from a broken leg that has become severely infected. Dr. Whitney can't fix the break until they get rid of the infection.
At least it doesn't smell anymore. The other thing that is concerning is that, this wound is already 10 days old at the time we started medical treatment, so the infection has a big, giant head start on us. If we go in and put implants in right now, the odds of them getting infected is way too high. You can't just go straight to surgery in that infected environment. All of that blood supply is critical to the bone healing in the end game. So before I can do definitive surgery to repair Raisin's broken bone, all right, give me a 2-0 nylon, please. I must first go deep within the wound and remove every bit of infected tissue. Mainly, we're looking for like anything that doesn't have a blood supply, like little foreign pieces of hair, pieces of bone. Sitting in here would just be a headquarters for infection. So we want to try to get all of that stuff out that we can. After we've removed all of the infected tissue that we can see with our eyes, we're going to install a wound vac to remove any infection that we can't see. All right, we got the bone covered. A wound vac system provides continuous negative pressure through a special type of sponge that not only keeps the material evacuated from the wound, but it also promotes it to heal. And that really helped get the tissues ready for the actual surgical procedure.
The wound vac will continuously clean Raisin's leg for the next 4 days. A local big cat rescue organization has an emergency. An African serval named Zuri, whose owner gave her up after she got sick and stopped eating.
Zuri is a 2.5-year-old female spayed African serval. She came to Tiger Creek as a surrender. She had been diagnosed with pancreatitis, and her previous owner was having trouble getting medications on board.
Okay, so how do you think she's doing?
Honestly, she hasn't eaten and she hasn't had anything to drink. When she was first diagnosed, her previous owner, he was able to get food into her. And then I guess over the course of the last week, things have started to progress to the point where her main reaction to anybody saying hi to her is just to curl back up under her blanket and pretend you aren't there.
Okay, okay. Zuri has pancreatitis, and it's making her feel pretty crummy right now, so she doesn't want to eat. They can die from pancreatitis, but if you get them onto the right medications, then they oftentimes can recover from it. Hi, sweetie.
Hey, sweetheart.
Do you not feel so hot? When she stopped eating, he couldn't get her to take her medication, and so it's a pretty bad combination. You know how cats are. They don't like to be forced to do anything they don't want to do. So we're thinking of a feeding tube, which would make it where you can give her not only food, but also medications, to see if we can at least get her meds into her, because obviously the meds were helping her, but if she won't eat, you can't get the meds into her. So we're gonna help the owners along by putting in a esophagostomy tube so they can actually get some nutrition into her, as well as administer meds, and hopefully it helps make her start feeling better.
Okay, so I have sedatives.
Okay.
If I can just give her a quick butt poking.
Perfect. Good job.
Good job, kitty kitty. Zuri's condition has deteriorated pretty significantly at this point.
All right, sleepy one, you ready?
Her organs are just going to continue to shut down if we can't get that nutrition into her and can't get the medication that she needs delivered into her system.
Zuri's situation is critical. The only option to save her life will be inserting a feeding tube.
Look how long her neck is. So beautiful.
Zuri, the serval with pancreatitis, is getting a feeding tube.
What's the temperature?
1025.
Without the nutrition and medication it will deliver, Zuri will starve to death.
She has not eaten well for a couple of weeks, which in a cat is a big deal. So what we're going to do is place an esophagostomy tube down into the stomach so that we can bypass the mouth and the whole wanting to eat thing and just get much needed nutrition into this cat.
Are you guys gonna wait for the blood to run before Haniger does this, or just do it?
No, just do it.
For Zuri, we decided to bring in Dr. Heidi Hottinger, one of our soft tissue specialists. This is something that Dr. Hottinger does in cats very regularly, very routinely. And so while Zuri's a little larger version of what Dr. Hottinger is used to doing here, it's still the same anatomy. And so having someone who's done this a million times in our corner is really important.
Dr. Hottinger, how come you don't have your big cat hat?
Oh, you're...
I should have put that on. There are a lot of things coming into play with this cat because she's not a house cat. She's a wild animal. The feeding tube will allow her to receive nutrition as well as medication for her pancreatitis. Okay, we're good. It's in her tummy. The nice thing about the feeding tubes that we use is that we choose feeding systems that do allow the patients to start eating on their own when they have that stimulus, and that's very important. It's good because once she starts eating and is eating well on her own, she's maintaining her hydration status.
Then we can pull it at any point as well.
Okay, honey. It's gonna feel better, okay?
If the feeding tube is successful, Zuri will get her appetite back and start eating on her own.
With the feeding tube, we'll be able to medicate her and feed her and get her body stronger and healthier and happier. But she's still a very wild animal and afraid of us. So there are a lot of challenges associated.
I'm going to put it back on and just try.
Oh, jeez. Okay. Can you put something over her eyes? You know, this is an animal that has like a 10-foot vertical jump, and they're super, super strong. We want this to be as smooth and easy for her as possible. We don't want it to be traumatic and stressful. And we're not trying to hurt her. We just need to get nutrition into this cat.
So
There you
now
go.
just giving her medications.
Delicious. Yes.
There you go.
So this is not a long-term solution, but it's also not just a Band-Aid. We have to let her body get to a point where it feels well enough to eat.
And it's done.
And once she starts eating on her own in a volume that is, sufficient for her to maintain her weight and gain weight, then we can pull that feeding tube.
Here's your friends.
Hello, sweetheart.
She's all set. She's
Perfect.
a little worked up at the moment.
I don't doubt.
She just, is scared.
It's going to be a little bit on pins and needles here for the first few days. We're going to bend over backwards and climb up any mountain we have to in order to make sure that Zuri is taken care of properly. Let's go home, Zuri.
I once wound up with an orthopedic pin in my right ass cheek. True story. Came out of a bird's leg and wound up in my butt cheek. It was like stuck in there, and there's like scabby bird skin and stuff on it, and then it was in my butt. Yeah. I know, I was like, oh my God! It hurt like a Still don't know how it happened. I think someone set me up.
16 days since he was viciously attacked. Raisin's infection is finally under control, and he's ready for surgery to fix the badly broken bones in his leg.
Well, it looks better than I thought it was gonna look. I think we're gonna be able to move this over, leave this, and then T-plate here.
The surgery will be difficult. The location of the break leaves Dr. Whitney very little bone to attach a plate to.
I'm gonna take a sip of water and say a few Hail Marys, and I'll be right there. Let's just kind of look at it before we decide how we're gonna proceed. I just don't like the looks of that, do you?
Dr. Whitney opens the leg and gets his first clear look at the bone break, but the leg damage is far more extensive than he anticipated.
It's so fibrotic and scarred. Nothing is, kind of in its natural place.
Raisin's bones and tissues have begun to heal and fuse together incorrectly on their own, and are now surrounded by hardened scar tissue.
Everything is stuck to everything. Yeah, that's just adhered, scarred down.
Dr. Whitney dissects the scar tissue that is congesting Raisin's leg in order to line up the edges of the bone so it can heal correctly.
All right, so if we're not careful, we're gonna break this. I knew that if I wasn't pretty meticulous, I was gonna damage more soft tissue than I wanted. I think we're gonna probably go back about 2.5 centimeters and cut this off. I was trying to just remove enough to get the job done, but it went on and on and on and on. What I want to do is get a pin down the ulna. That'll give us a little bit of additional stability. It's bulletproof scar tissue. Come on, Wayne.
Raisin is several hours into surgery to reconstruct his badly broken leg.
Oh my gosh. Just hard bone and weak muscles. We're almost there, kinda.
For 2 hours, Dr. Whitney fights through the hardened scar tissue to get a stabilizing pin through the bone. But there's one more step.
I think I'm gonna put this plate on, and I'm gonna have to use the plate to fight the scar.
Fight the scar, like shove it under the scar, basically.
Am I crazy? The first time I tried to pull the bone back into alignment, it was like fighting the strongest rubber band you've ever seen. So I thought, well, I may be crazy for even trying to think that I can get it pulled over. But with Dr. Merkin's help, we were able to just work it over, and luckily we got it back into alignment.
The metal plate is put in place.
That's the stuff.
And after 5 long hours, Raisin's fracture is finally mended.
Oh, gosh. My neck is just like frozen. Man, this is brutal, wasn't it? Very happy with plate placement. It's going to be important that we monitor him for weeks. We can't have any residual bacteria in that wound that sets up shop around that metal plate or the screws. Because if it does, then it's going to require plate removal. I'm happy with this.
Yeah.
Just when you think you're out of the woods, it can go bad. All right.
Two weeks after surgery,
Hey, buddy. Want to go see Dad? Come on.
Raisin is doing something he hasn't been able to do in over a month. Walk on all 4 of his legs.
It's obvious that Raisin's attitude, his spirits are remarkably improved. He's happy, he's ready to go home, and I know his owner's ready to get him home.
There's Raisin. What you doing, buddy? Oh, you can walk again. Oh, my goodness. He's a good boy.
He was a very good patient. He was very, very brave.
I know, you weren't going to be able to walk anymore. And now look at you, you're going to be running. Well, he wouldn't have been alive had he not come down here. But he's a happy dog. He's my buddy.
Raisin will need to return for periodic checkups to make sure his bone heals correctly. But his newly playful attitude shows he's on the fast track to recovery.
I'm very happy for him and for Steve.
Dr. Vasquez, report to neurology.
Come on, Bubba's.
Toby, the 10-year-old Maltese, had back surgery to remove a herniated disc in his spinal cord that left him unable to use his back legs.
So today, Toby's going home after being in the hospital for about 5 days post-surgery. Still can't walk all the way, but he's definitely a lot better than he was before surgery. So he's walking pretty well on that right leg. Now he's just gotta heal. He's just gotta have time and rehab to heal. You know your mom is here. Go, Toby, go!
Oh my goodness, look at you. This is so good.
Yeah, he does better when floor with traction, but he's really moving that right leg really well. He's gonna get better every day.
Can I hold him?
Yeah,
or?
you can hold him.
Okay.
He's not 100% by any means, but we're on the path to recovery now. He's gonna get there. It's gonna take a little time.
This has been such improvement that it's really exciting. I know some people might just look at him as like a pet, but they're more than that for sure. It's just a blessing.
About 2 or 3 days after he went home, they sent me this video of him walking on 3 legs. I couldn't believe from when he left to just 2 or 3 days later, the improvement at home. All right. You know, it makes me feel good that I was able to at least, try to give him some quality of life for however much longer he has with Macy.
Toby.
Six weeks after undergoing surgery, Zuri, the African serval with digestive problems, is also making progress. Thanks to her newly installed feeding tube, she's getting nutrition and medicine, and has started eating on her own. Her pancreas is healing, and she should have her feeding tube removed soon.